When an athlete gets injured during a game, who is the first person to run onto the field and take care of them? Most people notice the coaches or the players, but behind the scenes, there's a trained healthcare professional making sure the athlete is safe. That person is usually an athletic trainer. Even if you do not play sports, athletic trainers are important because they help keep athletes healthy and safe at every level, from middle school sports to professional teams. As someone studying health and physical education, I've learned about sports injuries and the important role athletic trainers play in preventing and treating them. Today, I will inform you about the career of an athletic trainer by discussing their responsibilities, the education required for the job, and the different environments where they work. First, let's talk about the job responsibilities of athletic trainers. Athletic trainers are healthcare professionals who specialize in preventing, evaluating, and treating injuries. According to the U.S. Bureau of Labor Statistics, athletic trainers work closely with athletes to reduce the risk of injuries and help them recover safely. One major responsibility is injury prevention. Athletic trainers create stretching programs, warm-ups, and conditioning exercises to help athletes avoid getting hurt. They also teach athletes proper techniques and safety practices during training and competition. Preventing injuries is important because it allows athletes to perform better and stay healthy throughout the season. Another responsibility is evaluating and diagnosing injuries. When an athlete gets hurt during a game or practice, athletic trainers are usually the first people to respond. They quickly assess the injury to determine how serious it is and decide what steps should be taken next. For example, they may check for concussions, sprains, or broken bones. Their fast response can prevent injuries from becoming worse. Athletic trainers also provide treatment and rehabilitation. They help athletes recover by using exercises, therapy techniques, and rehabilitation programs. According to William Prentice in Principles of Athletic Training, rehabilitation is an important part of returning athletes to activity safely. Athletic trainers monitor progress and make sure athletes are fully healed before returning to competition. Now that we know what athletic trainers do, let's look at how someone becomes one. To become an athletic trainer, a person must first complete specific education and certification requirements. First, they must earn at least a bachelor's degree from an accredited athletic training program. These programs include courses in anatomy, nutrition, injury prevention, and emergency care. Students also gain hands-on experience working with athletes in clinical settings. After earning a degree, future athletic trainers must pass the Board of Certification exam. This exam tests their knowledge and skills to ensure they are prepared to work safely with patients and athletes. Passing this exam is a major step in becoming certified. In addition, many states require athletic trainers to be licensed or certified before they can practice. Requirements may vary depending on the state, but continuing education is often necessary to maintain certification. According to the National Athletic Trainers Association, continuing education helps athletic trainers stay updated on the latest medical practices and treatments. Once certified, athletic trainers can work in many different settings. Most people think athletic trainers only work with sports teams, but they actually have a wide variety of career opportunities. Many work in high schools, colleges, and professional sports organizations. In these settings, they attend practices and games, help athletes recover from injuries, and work closely with coaches and doctors. Athletic trainers also work in hospitals, clinics, and physical therapy offices. Some even work with military personnel, performing artists, or industrial workers. Their skills are valuable anywhere injuries and physical activity are involved. The career outlook for athletic trainers is also growing. According to the U.S. Bureau of Labor Statistics, employment for athletic trainers is expected to increase because more people recognize the importance of preventing sports injuries and maintaining overall health. As sports participation continues to grow, so does the need for trained professionals who can care for athletes safely. Now that we have explored their responsibilities, education, and work environments, let's review the importance of athletic trainers. Athletic trainers play a vital role in healthcare through injury prevention, treatment, and rehabilitation. Their specialized education and ability to work in many different environments make them an essential part of sports and healthcare teams. The next time you see an athlete get injured during a game, remember there is a trained professional behind the scenes making sure that athlete recovers safely and gets back in the game.